take time to submit to this House a reasoned, written ruling.
Our research findings are accurate. Ghana Statistical Service responds to the IGP insisting the latest corruption prevalence survey is truly representative.
Not like because we left out an institution, then there's a crack in the methodology. It's a strong and solid methodology, proving over the world, well tested.
We hear the government statisticians' response to the IGP's queries about findings in its latest corruption prevalence survey. Also in this bulletin, residents of Amrehia up in arms against a clay mining company operating in the area for polluting the environment with dust emanating from the activities.
I have reported this to EPA. I have reported it to EPA.
How many police now? Where did you pass? When you were building your house, what did you pass? Where did you build your house?
Now, later in the bulletin, a focus on Ghana's healthcare delivery standard. We hear some of your horrifying stories.
I have an experience with a healthcare provider at Kojo. We have to go through all the paper documents. By the time we were assisted, the child is gone.
The Medical Association has been condemning the act while calling for stronger systems of accountability in Ghana's healthcare institutions.
A public facility, by virtue of the fact that you are funded by the government of Ghana, you are mandated by law to care for every Ghanaian who walks into that facility. You cannot turn people away.
Speaker of Parliament Alban Bagbin has deferred a decision on Sarah Adwoa-Safo and two other MPs referred to the Privileges Committee for absenteeism. The minority and majority leaders had been at each other's neck on what should happen to the report of the Privileges Committee laid in Parliament. Parliamentary correspondent Kweku Asante now reports.
Majority Leader Osei Mensah Bonsu argued that the report of the Privileges Committee must be final and not subject to any vote from all MPs.
Mr. Speaker, the committees of this House has the authority to determine the urgency of a bill. Once they make the determination, it binds all of us. Plenary has no business in this. People should understand that. So this is not the first time a committee is authorized to make a declaration for and on behalf of the House.
Minority Leader Haruna Idrisu fought back, insisting a Privileges Committee report should be subject to the decision of the entire House.
We are about 120 and they are 55. For fear that you are going to lose the vote, you are saying you want statement. We won't give you statement. We will vote and you will lose. But Speaker, we are not ready. We are not qualified. We will lose.
Deputy Minority Whip Ahmed Ibrahim argued that the majority were afraid they would lose a vote if it came to that, whilst NDC MP Mahama Yarega argued that by law, all committees must report to the House.
That Parliament and the Parliament of Ghana is not the Speaker of Parliament, and that the Parliament and Parliament of Ghana is not the chairman of the Subsidiary Legislation Committee of Parliament, and that Parliament is not the majority leader, nor is it the minority leader. That the Parliament of Ghana is the well-constituted 275 members of Parliament elected thereon to exercise the legislative authority of Ghana on their behalf. On their behalf. And therefore, Mr. Speaker, so a report has to come to this House, and the committee has to demonstrate to this House that the person was given the opportunity to exercise reasonable explanation, and the person did not provide reasonable explanation.
So this has been a long-drawn battle. The lines are drawn now. The majority side are going all out to argue that Sarah Adwoa-Safo should lose her seat, whilst the minority, surprisingly, are rather supporting the Member of Parliament, saying, if anything at all, that debate must come to the floor and the 275 members of Parliament should take that decision. It is expected to drag on for a while. When Parliament resumes in October, members will be expected to go back to this vexed question and take a decision that will potentially leave some precedent for the future. This Sarah Adwoa-Safo saga is not going away. Speaker of Parliament Alban Bagbin ruled that a decision will be deferred until MPs return from their recess in October.
I have consulted the old lady. The old lady has given me an advice, and I think that advice is correct, because the issue raised by the majority leader is both of substantive and procedural law. And I need time to submit to this House a reasoned, written ruling. I cannot, in the haste of today, give you the ruling.
Now, constituent of Dom Kwabenya divided over the proposal in Parliament to declare the seat vacant. The Privileges Committee recommended that the seat be declared vacant after months of trying to reach out to her failed. But the resident whom she represents are undecided about it. Michael Ashley was in the community earlier.
Parliament's Privileges Committee is recommending that the Adwoa Safo seat be declared vacant. According to them, she failed to make use of all other avenues to reach out to them and also get to her. So they are effectively declaring her seat vacant. We are in the constituency, Domi Kwabenya constituency, asking the residents, the constituents, what they make of the whole Adwoa Safo issue, whether the recommendation should be followed through or she should be given some more time to respond adequately. Daddy, what do you think about the Adwoa Safo thing? Should the recommendation be taken through that she should be asked to leave the seat?
I mean, we can say Adwoa Safo near Panasempa. That's what we are trying to come in my dream. I say the city be fine because in Penfosu here, that's what you're doing more man. That's what Madia. I say to me, uniform for a finance over constitution.
You know, he can't be on the sea why he's not working. So if he's working perfectly, we don't have any problem with it. But since he's not there, the seat is vacant. And Domi Kwabenya people are suffering. What he's supposed to do, he's not doing. So if they call her and he's not coming, they should find someone who can do the better work for us.
Me padia ke kamen kwa kaye friend e se ko mbra embe yina no but say amba me yina no yanka say afenu sun dia 4 years yen to abama be yina free so.
Oh, I think for now they should give her some times because you know you can't just let her go like that. You just give her some time because I've heard that she's around, so maybe she will come to the parliament and explain everything.
Okay, I think they should give her some time because maybe it's because she's having a tangible reason for not attending the meeting or not responding to the calls. So they should just give her some time and see. But if she's still not responding, then they can take her off.
Now, a not-for-profit organization, ODICRO, has challenged the Speaker of Parliament's decision to refer 3 members of Parliament to the Privileges Committee. According to the Parliamentary Monitoring Organization, Mr. Bagbin should have had 33 MPs and not 3 on the list he forwarded to the committee on May 4 this year. ODICRO says its analysis and position on the absentee MPs is grounded on the vote and proceedings from Parliament. According to the latest ODICRO report, these are the MPs who should have also been referred to the Privileges Committee. Now, let me run you through how this is, or that those who were supposed to have been there. We have Sarah Adwoa Safo, Dom Kwabenya. We have Korte Henry, who is for Ayawaso Central. We also have Ajenim Boating Kweku, Brekum West. We have Joe Gatti of Eskado Keten, former Railways Minister. We also have Ajimamenu Kweku, Dome Central. We also have Daku Mensa Kwabena Ochre, who is for Takrade constituency. We also have Mahama Farouk Omar Aliu Yendi. We also have Edichum Yao Ose, Dr. Yao Ose Edichum, Minister for Education, Bosomche constituency. We have Ambrose Derry, which is for Nandom. And then in Team Adelaide Mace, which is for Nsuta Kwamang Beposu. So those are it. Again, some of the people who should have been on the list include in Team Augustine Collins there, who is the Deputy Minister for Local Government of Finso North, Mafo Emmanuel, Dr. Ofori Krom. We have a Gifty Chum Ampofo, Ebuakwa North Constituency, and Prechum Sapon Kweku, Mampong Constituency. Also on the list, Mustafa Usif, Yagaba, and Kabori. That is that. Again on the list, we have Teddy Safo Adi, Ayen Suano Constituency. Also Beram John Jaba, Zabzugu Constituency, and Chreme Nelson Brekum East Constituency. All of these people, according to Odikro, should have been on the list of people who were referred to the committee. Now, our findings are accurate. That's the Ghana Statistical Service's response to the Inspector General of Police, Dr. George Ekufo Dampare, on the latest corruption prevalence survey, which ran Ghana Police Service as the most corrupt public institution in the country. This follows an outright rejection of the findings of the survey by Dr. George Ekufo Dampare, who described the research as heavily challenged and corrupted. Now, Shraj, UNOCD, and the Ghana Statistical Service, as well as the CDD's Afrobarometer, all ranked the police service poorly. In a 5-page letter, the IGP said there is a high risk that the research may have been affected by a long-held stereotype against the police. In all, the police service raised 14 concerns, including the use of a selective ranking. The research failed to capture other public institutions, at least 13 of them, including Shraj and the Ghana Statistical Service, which undertook the research. They also say there was disaggregation in certain public institutions, having the tendency to affect weighting in ranking. Again, the Ghana Revenue Authority, customs officers, and tax officers were part of the reasons the police cited. Number 5, Ghana Health Service, doctors and nurses, plus other health workers. Now, let's bring in the government statistician, Professor Samuel Kobna Enim, to help us answer some questions here. Prof, thank you so much for agreeing to speak to us. To start with, was the Statistical Service included in this research? Prof, kindly unmute so we can hear what you're telling us.
Thank you very much. Great. So the Statistical Service as an institution is not in the report, is not in the questionnaire. But this gives us the opportunity to try and appreciate what guided the research that we did. We have produced a statistical product, and we need to be clear in our minds that the object of the work was not to rank institutions, and that didn't feed into the methodological processes that we went through in doing this exercise. However, having done the work, we realized that we have enough responses to do some sector or institution level computation of the prevalence. So to begin with, anytime you want to compute a statistical product, the first thing you need to ask yourself is, what are you measuring? And what we are talking about here is the prevalence of payment of bribe in the country. And the Sustainable Development Goals, specifically indicator 16.5.1, clearly encourages countries to measure prevalence in a specific way for purposes of international comparison. And once you are doing that, you enumerate for the measurement 2 things: people who were asked to pay bribe and they paid, and people who were asked to pay bribe and did not pay. How do you compare this population of people who either pay bribe, or those who were asked to pay bribe and did not pay? The denominator are those who made contact with public officials. So the first thing we need to keep in mind is this data collection is not from an institutional perspective. This data collection is from a household individual perspective. So specifically, we identified 15,000 households based on our recent population and housing census. And we got into these 15,000 households, identified an adult member, and preceded the data collection with whether in the past 12 months you've made contact with a public official. And then we had subsequent questions that led us to arrive at the prevalence. The other thing that we need to bear in mind is, because the data is coming from the household level, not from the institutional level, it will be pretty difficult to capture all the institutions that we have in the country. What makes this difficult is that when you are doing sampling and you want to do analysis at different levels of disaggregation, you ask yourself, how can each category be represented in the sample that you have? We have in excess of 300 public institutions in the country. We sampled 15,000 households. So once you put that into your sampling procedure, even if they are mutually exclusive, you are getting a maximum of about 50 per institution out of the 15,000. You cannot do any meaningful disaggregation at the regional level and any other demographic level, i.e. education, age categories, and so on. We did a sampling based on the regional disaggregation, district and rural urban. And from the sampling point of view, we didn't capture institutions. But as I indicated, because the work or the measurement is based on having had contact with a public official, we identified based on literature and previous studies the institutions that have had contact with the public. We did a test ahead of this exercise, and we also looked at the GLSS 7, which we have a module on governance, peace, and corruption. So once you go through all this and you have in mind that you are targeting institutions that engages frequently with the public, that is why we arrived at those institutions. Let me also put on record that based on the pre-test and information from the Living Standards Survey, the questionnaire has module on, has a category other public and civil service institutions. And if you look at the numbers that we got there, they were pretty negligible, because how many people in the public would engage Ghana Statistical Service? How many people would engage TRAJ? How many people would engage Narcotics Audit Service relative to the Ghana Police? And why we need to be clear in our minds that the objective was not based on ranking. The measurement was those who made contact with the police. So we call it within institution prevalence. Those who made contact with the police, how many of them paid bribe? So it isn't an issue of you look at those who paid bribe in Ghana and spread them across the institutions. So whether we took into consideration what is happening in Audit Service, Ghana Ports and Harbors, we looked at the institutions that engages more with the public, and for that particular institution, we computed the percentage within that institution.
But the police also thinks that stereotyping could probably have worked against them, such that someone who has not even gotten into contact with them could say the police because of what they hear always about the police service. Couldn't that have been a factor?
I mean, based on the computation approach that I've just shared with you, there's no way stereotyping got into it. Unless the argument is that we ended up getting a lot of the public having engaged the police, which we do not need any data collection exercise to do. As I indicated to you earlier on, different demographics, different geographical areas would have more contact with police by virtue of the work that they do. And let's keep in mind that when you are measuring prevalence, which is one of the issues that they put in their letter, you should have made contact at least once. The measurement of prevalence does not include the number of times that one individual engages the public official. And the reason why we do that is immediately you discount for the number of times that a public official engages with the public. You sort of compromise the approach to eradicating the payment of bribes. The reason why we say that is whether you engage somebody 10 times or not, the point is that bribe payment should not occur. So once you start discounting by, I engage the public more, so once you are computing the statistics, discount it by that, then what are we trying to do as a country? Once it's not good, it's not good. And then you don't have to go ahead and say that I meet the public much often, so there is a need to discount that frequency when you are calculating the frequency.
So what would be your advice to the Ghana Police Service on how they approach this research?
Let me put on record that we have worked closely with the Ghana Police Service right from the conceptualization of this survey. To contextualize the work, we set up a steering committee and a technical committee, of which the Ghana Police Service was represented. They have been pretty much involved in the finalization of the questionnaire, the analysis of the data, and some highlights of how the results will be put out there. We have gone ahead to decide that we're going to do stakeholder engagement with institutions, including the Ghana Police Service, on the kind of disaggregation that in the letter that we have all read, they are requesting for. And it is that conversation that we need to have. And secondly, put to the public that you cannot use only one survey to say that this is the extent of a socioeconomic challenge that you are having. That is why we need to complement these surveys with other administrative data. Because I hear others say that the volume of bribe payments in some institutions are so high that for you to say an average of 348 Ghana cedis is the bribe that we pay in Ghana is not realistic. I do associate with that reason, but this is where you need to think about other data sources to really complement. And I'm happy Ghana Statistical Service for the first time has put out a figure that corruption in Ghana for 2021, bribe payment in Ghana for 2021 among public officials is 5 billion. And it's generating the conversation that we all need to have to appreciate how this is affecting our macroeconomic indicators.
Prof, thank you so much that you could find time to join us on our news. Now, residents of Amrehia are up in arms against a clay mining company operating in the area for polluting their environment with dust emanating from their activities. According to them, for close to a year, the company has allegedly operated without authorization and is polluting the area. Residents say the Environmental Protection Agency is yet to act, though they have been petitioned several times about the occurrence. Joy News went to the area to assess the situation, and this is what we saw. It started off as a complaint from one of the residents in this community.
Resania almost sober. Resania almost sober. A dime way and Kwalegum. This is what I'm talking about. This is what I'm talking about.
So we had to come and check for ourselves how this is developing. This is Amrehia. It's a place where I'm told Dr. Kwame Nkrumah took from the family for agricultural purposes. So we have the dairy farms here. But as time went on, some people have turned this place into a place where they win topsoil. Now, because of heavy trucks, anytime they pass here and because of how loose the topsoil is, it just blows away and into their homes.
We can't open our windows. The road and our building is just a stone throw, and we can't open our windows. We can't cook because my cylinder is inside. Risk, so we cook outside. Dust. I just gave birth to a little baby. She's only six months, and she couldn't breathe. She was just like asthma attack. It's very hectic. The road, we had constructed gutters, they blocked the gutters. We've taken videos of it. We said we were doing how do you call it, road speed ramps. Still, they came to remove everything, fighting us with land guards and all that. And also police, we've reported to the police station, everything. We don't know what to do. There are kids inside this house, shops around and everything. It's too much. They come even at night sometimes. Midnight. They start around 4. At times 2 a.m. At times 2 a.m. They'll pack their cars and the engine will be on, and it's too much. It's too much. Aside from the dust, the noise. Just look at where the road is and where my window is. The noise. When my baby is asleep. No, sorry.
If you look at the palm tree behind us, tells you how devastating this pollution is. You ask yourself, but for the palm tree, where would have the dust on it settled? The container in front of the palm tree, we are told, is a tailoring shop. Because of the dust pollution, the owner, Isaac Kofi, has stopped operations.
Somewhere last year, September, we saw some official cars coming to Daily Farms area there. A lot of them, when they come, they go. They came, they go. They came, they go. Unfortunately, we saw a bulldozer which came and entered the place. We don't know, they didn't inform the residents here. We don't know what is going on. Because when I came here, it's about 20 years ago. This way, nobody has tempted that area. We all know that it's a farm made by Dr. Osagyefo Kwame Nkrumah. But unfortunately, they started digging the place, then the dust coming into our houses. You can't dry your things. When you wash, you can't dry. Our rooms, everywhere. The children, in fact, we are suffering. We are suffering. The cars in the night about 2 a.m. Then they start coming.
Sometimes they do all night.
When they started, they do day and night. And so sometimes it became only day. In the night, when they reach here, they will be blowing the horn. Then the noise of the vehicle will also be applying. They made bang, beep, 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 beep. Oh, in fact, we can't sleep. They disturb us. The children, especially the children. So this is our problem.
Some of the residents have been sharing with us their sides of the story. One man in particular said his wife has been complaining of sinuses since the beginning of the year, and they suspect it is as a result of the pollution in this area.
I live about 2 blocks away, and yet we have so much dust pollution in our house. Since the beginning of the year, my wife has been suffering from a sinuses problem with the dust inhalation. If you come to our house, the windows are all red. If you wash your car, by the following morning, it looks red. And I spoke with EPA, and clearly these people don't have a permit, because if they had one, they would have had to even erect a signpost with the EPA permit displayed. But as the people were telling you, sometimes they come and work in the night. So apart from the dust pollution, there's also noise pollution. In the middle of the night, you can hear the equipment and the movement of the tipper trucks. And it's just not acceptable. Nobody is preventing you from doing your business, but you have to also be mindful of the other citizens who also live here. And I call on the EPA to make sure they do the right thing. If they want to continue using this place, then they have to put gravel and on the road, and also water the place as regularly as the EPA will instruct them to do.
All that the residents here are asking for is for authorities to move in and to ensure that this pollution is stopped. But when will this solution come? Your guess is as good as mine. For Joy News, from Amrehia, I am Samuel Kojo Brace. Now still to come in the bulletin, minority demand that President Akufo-Addo instruct Communications Ministry to extend deadline for SIM card registration, which is due in 3 days. We'll be back with more stories. Stay with us. Welcome back from the break. Now, there's no justification for public and private health facilities to reject and turn away patients who need immediate treatment. That's a warning from the Ghana Medical Association. Speaking on the Super Morning Show, General Secretary of the Association, Dr. Titus Bayo, recognized that although private outfit may choose to not accept certain patients, the death and complications some patients suffer due to cases of outright refusal of admission are unacceptable. Dr. Titus Bayo made the reactions after some listeners of Joy FM shared their experiences of how they were left unattended to by health officials, even in their need of urgent medical care.
I have an experience with a health provider at Kojo. We have an emergency. We got the. We have to go through all the paper documents before we are accepted. By the time we were accepted, the child is gone. And you get there, and they want to do all paper documents before they attend to the person. But this is an emergency. So by the time they finish everything, the child is gone. And this was under their care.
I rushed a patient to the Tema General Hospital. I went there and we parked at the OPD. We called on them for emergency. They asked me as the taxi driver to go in for wheelchair. I said, how on earth? I'm a taxi driver. I brought the patient. You, the nurse, it's your duty to bring wheelchair. You are asking me, the taxi driver, to bring wheelchair. And I went for the wheelchair. I let the patient sat on it. And I pushed it to the OPD. And you know, with taxi, because of emergency, you cannot even stand and be waiting for the person for payment. And I drove back.
It's not all gloom with the health service. I had surgery at Kojo, and I really would like to commend the entire staff. The nurses, they were fantastic. And they made you feel less of the pain that you go through.
I went into labor a day after lockdown. So there was no vehicle from 3 a.m. to like 5 a.m. There was no vehicle. So I had to deliver in the house. My mom was around. So I said, okay, since we weren't getting a vehicle, there's a polyclinic around our place. We can walk there. When we went the next day, and the midwife, they got angry. They said, I don't come for antenatal here. So why do I have to come here and all that? And I was like, it was an emergency. There wasn't vehicle at that time. For like 3 hours, I had to deliver in the house. So you just check the baby, check myself, cut the cord and everything that, hey, it took us like 1 hour. I should pay this, I have to buy this, and then do that. And after all, they didn't even check the baby. They didn't bath or clean her. They just left her there and then left me there. In about 30 minutes, I was pressed. I wanted to use the washroom. The first midwife told me the tap is not running, so I can't use the washroom. So I was so pressed that for 1 hour, I didn't know what to do. She wouldn't allow me use the washroom just because she said I didn't attend antenatal when I was pregnant. So at the end of the day, I had to be on the bed. Because considering the fact that I had a cut and I was sick. So later on, I think about 2 weeks later, I went to the hospital again. And then I was told I had infection due to the cut and they didn't stitch it on time and a whole lot. It took the grace of God for me to survive.
Some very touching testimonials there. Dr. Titus Bayo said it is a violation for any public hospital funded by the government to ignore a patient in an emergency.
The teaching, and it has always been, in the case of an emergency, we have what we call resuscitation. Resuscitation can always go alongside initial details of the patient. Yes, the details are very important because they tell us what you can do and what you cannot do. So we need to know your name so that we don't even confuse your medication with another person. We need to know your age, so we give medication that is age appropriate. We need to know your gender, which will be obvious to us, and a few other things. These are important. Your vital signs will tell us what to even do and not to do. Some patients may see this as time wasting, but we have always taught students and clinicians that do not waste unnecessary time doing these things. And some obvious things can go hand in hand. So you've seen a patient who is unconscious. Start the process of resuscitation even before you want to ask this. The person cannot tell you their name. They cannot tell you bank details. They cannot tell their mode of financing. So what is obvious to you, it is expected that you will start that whilst you get the additional information. But definitely those informations are also important for this care and for subsequent care to prevent medical errors. No facility has the right to turn anybody away in an emergency. In a walk-in, private facility can decide, okay, we do not wish to have you as our patient. But a public facility, by virtue of the fact that you are funded by the government of Ghana, you are mandated by law to care for every Ghanaian who walks into that facility. You cannot turn people away.
Now, with 3 days for the SIM card registration exercise to end, the minority is asking President Akufo-Addo to cause the extension of the exercise. Speaking to journalists in Parliament, Deputy Ranking Member on the Communications Committee, Sam George, said it's a national security imperative to extend the exercise.
We want to use this means to call on His Excellency, President Nana Addo Dankwa Akufo-Addo, to instruct his Minister for Communications and Digitalizations to rescind her decision on the deadline, as it holds potential national security implications for millions of Ghanaians who have not been able to, due to no fault of theirs, register their SIM cards. We urge the President and National Security Minister not to treat this issue with kid gloves and take cognizance of the brewing threat of terror and ensure that millions of Ghanaians who earn a living by the use of their SIM cards on a daily basis are not disenfranchised.
Now, Ranking Member on the committee, Alhaji A.B.F. Husseini, wondered why government is insisting on only the Ghana card for the registration when so many Ghanaians are still yet to secure the card.
So we all know that accessibility to the Ghana card today is not available to millions of Ghanaians, tens of millions of Ghanaians, through no fault of theirs. Indeed, just about 2 weeks ago, the NIA was in this house to brief the house, and they themselves considered that not only do they not have offices across all the districts of this country, but that they are even handicapped in terms of even bare logistics, like printing cards, common ordinary printing cards, staff, and other logistics to be able to meet the growing needs of the people in respect of the obtaining of this card. And so they considered that they have challenges for which they sought the assistance of Parliament to get done. So if you cannot afford everybody access to the Ghana card, why are you making it automatic, compulsory? And in doing so, let me quote the relevant portion that the minister is seeking to use. The minister is seeking to use LI 2111. And LI 211, if you read it, it doesn't tell you that it is the sole document. It says it shall be a principal document. Principal is not coterminous with sole. And indeed, we ourselves have had the opportunity to sit with the minister and indicate to her that she should include other forms of identification, such as the voter ID card, which is popular. The voter ID card, for instance, there are over 70 million Ghanaians who have a voter ID card. Can you imagine that if they allow the voter ID card, how many Ghanaians can immediately go and authenticate their SIM cards?
Now, the governing New Patriotic Party is positioning itself as the party that has introduced the most social interventions in governance since the inception of democracy. Addressing the media as part of activities to mark the party's 30th anniversary, General Secretary Justin Kojo outlined the introduction of Metroma system, free SHS, as some of its major social intervention achievement. The anniversary celebration is under the theme Shared Traditions, Holding and Working Together for a Stable and Prosperous Nation. A report by Samuel Imbra.
The NPP, born in July 1992, came from the Dankwa Buzia Dombo tradition, anchored on an ideology of property-owning democracy. Led by John Ejekum Kufuor, the party had its first taste of power in the year 2000. Speaking at the launch of the NPP's 30th anniversary celebration, General Secretary Justin Kojo explained the role of some leading members of the party when there were attempts to make the country a one-party state.
When Ghanaians became disillusioned by the socio-economic conditions under the Champon regime and the proposed union government referendum, once again it took members of the Dankwa Buzia Dombo tradition, notably Nana Addo Dankwa Akufo-Addo, BJ Darocha, and William Oferacta, to partner people such as Komola Gbedema, General Kwesi Afrifa, and other members of the opposition groups to form the People's Movement for Freedom and Justice, popularly known as the PMFJ, to demand Ghana's return to democratic rule.
He said the MPP came into office at a time when there were economic challenges, but worked hard to better the lives of Ghanaians.
It was not until January 7, 2001 that the Dankwa Buzia Dombo tradition had its second opportunity at governance following the swearing-in of John Ajekun Kufuor as president. Indeed, it was a trying time to assume office, and some felt we had been served a poison chalice because of the very challenging economic condition the country was in.
Justin Kojo listed some social intervention policies he believes make the MPP Ghana's best political party.
The Kufuor administration took the brave but unpopular decision to subscribe to the IMF highly indebted poor country program. Despite the gloomy economic condition at the onset of his administration, the Kufuor government will perform what many have termed as the miraculous economic turnaround. By his second term in office, notably among his achievements was the attainment of a lower middle income status economy in 2007, introduction of the National Health Insurance Scheme, the school feeding program, the Livelihood Empowerment Against Poverty LEAP, the National Youth Employment Program, Metro Mass Transport System, cocoa mass spraying, repeal of the criminal libel law, the capitation grant, and many more.
Speaking on reorganization ahead of the 2024 general elections and hopes of breaking the 8, the General Secretary admonished supporters of flag-bearer aspirants to avoid politics of insults and attacks. For Joy News, Samuel Mbura, Accra.
And that's how we wrap up the bulletin. There's more news on myjoyonline.com. My name is Samuel Kojo. Do enjoy your evening.